The Black Death first appeared in the Byzantine Empire around 1347. It was brought to Constantinople via trade routes from the Black Sea. The plague spread rapidly through the densely populated city of Constantinople. Constantinople's population density and lack of hygiene practices facilitated the rapid spread of the disease. The Black Death was caused by the bacterium Yersinia pestis. This bacterium is primarily transmitted through the bites of infected fleas. Symptoms of the Black Death included high fever, chills, and painful swellings called buboes. Buboes were particularly noticeable in the armpits, groin, and neck areas. The mortality rate of the Black Death in the Byzantine Empire was estimated to be around 30 to 60%. This high mortality rate led to a significant decrease in the population and labor force. The plague had a profound impact on the social structure of the Byzantine Empire. Social hierarchies were disrupted as the wealthy and poor alike succumbed to the disease. Religious institutions played a crucial role in providing care for the sick and burying the dead. Monasteries and churches often served as makeshift hospitals and burial grounds. The Byzantine government struggled to maintain order and provide adequate health care. Limited medical knowledge and resources made it difficult to effectively combat the plague. The Black Death led to a shortage of labor, which affected agricultural production. With fewer workers available, farms and fields were left untended, leading to food shortages. The economic impact of the Black Death was severe, causing inflation and economic instability. The loss of life and labor disrupted trade and commerce, leading to higher prices and financial turmoil. The plague caused a decline in urban populations as many people fled to rural areas. Cities like Constantinople saw a significant exodus of residents seeking safety in less crowded regions. The Black Death had a psychological impact on the population, leading to widespread fear and despair. People lived in constant fear of infection, and the high death toll created a pervasive sense of hopelessness. The Byzantine Empire experienced multiple waves of the Black Death over several decades. The plague recurred in various forms, with outbreaks occurring in 1361, 1369, and 1374. The plague had a significant impact on the military capabilities of the Byzantine Empire. The loss of soldiers and the disruption of supply lines weakened the empire's ability to defend itself. The Black Death contributed to the decline of the Byzantine Empire's power and influence. The empire's weakened state made it more vulnerable to external threats and internal strife. The Byzantine Empire's response to the plague included quarantines and public health measures. Efforts to isolate the sick and prevent the spread of the disease were implemented, though often ineffectively. The plague led to a rise in religious fervor and the belief in divine punishment. Many people turned to religion, believing that the plague was a sign of God's wrath. The Black Death had a lasting impact on art and literature in the Byzantine Empire. Themes of death, suffering, and redemption became more prevalent in artistic and literary works. The plague disrupted trade routes and economic networks within the Byzantine Empire. The closure of markets and the reduction in trade activity had far-reaching economic consequences. The Black Death led to changes in inheritance laws and property distribution. With so many deaths, the rules governing the transfer of wealth and land had to be adjusted. The plague had a significant impact on the Byzantine legal system. Courts and legal processes were disrupted, leading to delays and inefficiencies in the administration of justice. The Black Death affected the Byzantine education system, leading to a decline in scholarly pursuits. Schools and universities suffered from a lack of students and teachers, hindering the transmission of knowledge. The plague had a profound impact on family structures and social relationships. Many families were torn apart by the loss of members, leading to changes in kinship and community dynamics. The Black Death led to a shortage of clergy, affecting the functioning of religious institutions. The death of priests and monks meant that many religious duties and services were left unperformed. The plague had a significant impact on the Byzantine military, leading to a shortage of soldiers. The loss of trained warriors and the disruption of military training programs weakened the empire's defenses. The Black Death led to a decline in the population of Constantinople, the capital of Byzantine Empire. The city's population dropped dramatically, affecting its economic and cultural vitality. The plague had a lasting impact on the Byzantine economy, leading to a decline in tax revenues. With fewer people and less economic activity, the government's income from taxes decreased significantly. The Black Death led to a rise in crime and social unrest due to the breakdown of social order. The chaos and fear caused by the plague created an environment where lawlessness and disorder prevailed. The plague had a significant impact on the Byzantine healthcare system, leading to a shortage of medical professionals. Doctors and nurses died in large numbers, leaving a critical gap in the provision of medical care. The Black Death led to a decline in the quality of life for the surviving population. The loss of loved ones, economic hardship, and social disruption took a heavy toll on the well-being of survivors. The plague had a significant impact on the Byzantine agricultural sector, leading to a decline in food production. With fewer farmers and workers, crop yields fell, exacerbating food shortages and famine. The Black Death led to a rise in the cost of labor as the demand for workers increased. The scarcity of labor meant that those who survived could command higher wages and better working conditions. The plague had a significant impact on the Byzantine legal system, leading to a backlog of cases. Courts were overwhelmed by the number of disputes and legal issues arising from the pandemic. The Black Death led to a decline in the population of rural areas as people moved to cities in search of better opportunities. The rural exodus exacerbated the labor shortage and further disrupted agricultural production. The plague had a significant impact on the Byzantine education system, leading to a decline in literacy rates. The closure of schools and the death of teachers meant that fewer people received formal education. The Black Death led to a rise in the power of local authorities as central government control weakened. Local leaders and administrators took on more responsibilities to manage the crisis and maintain order. The plague had a significant impact on the Byzantine economy, leading to a decline in international trade. The closure of ports and the reduction in shipping activity affected the empire's trade relations with other regions. The Black Death led to a rise in the use of herbal remedies and traditional medicine. With limited access to modern medical treatments, people turned to natural remedies and folk practices. The plague had a significant impact on the Byzantine legal system, leading to changes in inheritance laws. New laws were enacted to address the challenges of transferring property and assets in the wake of mass deaths. The Black Death led to a decline in the population of the Byzantine Empire's military forces. The loss of soldiers and the disruption of military training programs weakened the empire's defensive capabilities. The plague had a significant impact on the Byzantine economy, leading to a decline in the value of currency. Inflation and economic instability caused the value of money to fluctuate, affecting trade and commerce. The Black Death led to a rise in the number of orphaned children, creating a social welfare crisis. Orphanages and charitable institutions struggled to care for the growing number of children who lost their parents. The plague had a significant impact on the Byzantine healthcare system, leading to the establishment of new hospitals. To address the overwhelming number of sick patients, new medical facilities were built or existing ones expanded. The Black Death led to a decline in the population of the Byzantine Empire's artisan and craft communities. The death of skilled workers affected the production of goods and the quality of craftsmanship. The plague had a significant impact on the Byzantine legal system, leading to changes in property rights. Laws were adjusted to accommodate the changing dynamics of property ownership and inheritance. The Black Death led to a rise in the number of abandoned properties and lands. As people died or fled, many homes and fields were left unoccupied, leading to a decline in property values. The plague had a significant impact on the Byzantine economy, leading to a decline in the production of luxury goods. The demand for non-essential items decreased as people focused on basic survival needs. The Black Death led to a rise in the number of religious pilgrimages and spiritual practices. Many people sought solace and protection through religious rituals and pilgrimages to holy sites. The plague had a significant impact on the Byzantine legal system, leading to changes in contract law. New laws were introduced to address the challenges of enforcing contracts and agreements during the pandemic. The Black Death led to a decline in the population of the Byzantine Empire's merchant class. The death of traders and the disruption of trade routes affected the economic activities of the merchant community. The multifaceted impact of the Black Death on the Byzantine Empire highlights the social, economic, and cultural changes that occurred during this period and eventually leads to the empire's downfall.